What's up, y'all? This is Not a Real Doc DPT, and no, I'm not a real doc, but I am a licensed and practicing doctor of physical therapy. And today we're going to do another video in our Behind the Doctorate series. The whole intent of my channel is to be more patient focused, but in this particular series, patients might still get some benefit from this. So if you are a physical therapy patient, you could still benefit from listening. But it's also a little bit more targeted towards people who are currently students of a DPT program or maybe considering going into physical therapy, that kind of a thing. And today I wanted to talk about what are reasons that your patients may fail with physical therapy, and why might you not be successful with a patient. So I came up with 8 different things and 8 different topics. There are probably more, but these are the ones that I could think of that uh, are reasons why you may not have good success with a patient. So number one is um, this is a one that you're going to run into quite a bit, and that is that patients are not compliant. They just are simply not listening to what you're telling them. They're actually not participating in their home exercise program. Um, that is that is probably one of the biggest things that you're going to run into of patients that are only working when they're with you. You'll hear this typically from their spouse or another family member, and that statement will be something to the effect of, "Yeah, when they come into physical therapy, that they work hard with you, but then when we go home, they're not doing anything at all." So um, that's an area that can become a real problem because physical therapy isn't magic. That's why I try to explain to patients on that very first evaluation visit, just to set expectations, because the physical therapy is not magic. It's work. It's hard work that they do and that you do, or that they do with you, the physical therapist, as well, so that they can actually make progress and proceed within their recovery. But so that's the number one reason I would say that patients are going to fail with you. A second reason that patients may fail is they don't try. So they may actually participate, they may actually be sort of compliant, but they're just not trying. Um, these types of patients are often going to have a lot of cancellations or missed visits on your schedule. So they're not actually giving a good faith effort on their side with actually even participating in physical therapy. So that creates a barrier in how far you're going to be able to progress with them. Third thing that I was able to think of, or that I have thought of and have seen and experienced with patients, would be they're not controlling their medical very well. I mean, physical therapy is really based on, or good physical therapy, let's say, is based on the idea that a patient's medical has stabilized off somewhat, so that then or that they can provide a platform that we can build off of in physical therapy. So I usually tell patients that, if your medical's all over the place, it's going to be really hard for us in physical therapy to significantly progress with you. But if we can get your medical to stabilize off, then yeah, physical therapy can do great, sometimes miraculous things. But you need your medical to be stabilized off. A fourth reason that a patient may fail with you in physical therapy is um, they don't trust you. This actually can be a big one, especially if you are doing or having to treat a patient with manual therapy care that may be painful. If you're doing myofascial work, um, trying to do scar massage, even dry needling, it, it's it's going to hurt, and it may hurt a little or it may hurt a lot, and so if you can't get that patient to trust you, and if they're not willing to trust you, then you're not able to actually push them hard enough sometimes. I've had patients who I knew that I could help them with their issue if I could do the highest level of intensity of manual or of myofascial release that I do. But I was unable to deliver that to the person because I knew I couldn't get them there. I knew that they wouldn't trust me enough to allow me to be able to deliver that sort of treatment for them. So I had to take a different tact and do something different to try to help that patient. But that can sometimes become a very significant barrier. Is when your patients, when you can't get them to trust you fully, so that you can just deliver the type of care that is necessary for them to progress. A fifth reason that your patient may fail is um, this is also can be another big one, and it you may see this in home health. You may see this sometimes with workers' comp patients. Um, Patients may become comfortable in their station, so they don't want to improve. They're pretty okay with the new status quo and don't want to change. Um, some of your therapy care may need to be related to the mental aspect of that and helping to um, try to balance that off to try to help progress them. And I'm gonna go ahead and go into my sixth reason that I've come up with as to why patients often would fail with physical therapy, and it goes right kind of hand in hand with number five there, which is sometimes patients get power and agency, I guess you could say, in their injury and dysfunction, and that's a tough one. I have had those patients, and you see them where there's just this. You can see it. It's a family dynamic that's present, where a person is getting power from all or over all of the remaining family members, whether it's a spouse or kids or whatever, all because that patient is sick or that patient is injured, and they have been for a year now or 2 years now or 3 years now. And so so this is a case where it's not just that like I mentioned in number five, where that person is comfortable in their station and they're not looking to improve. No, number six is maybe when that comfortable in the station patient has now progressed on to where now it's affecting the entire family, where this person is used to being waited upon and helped to an infinite degree in all aspects of their lives, and there's a power there that they like. Um, that's a hard one to treat. I've found that's probably one of the most difficult types of patients to treat because that's a patient that not just doesn't want to get better, they actively are being rewarded by not getting better. So that's a tough one, and that will be for me. That's a hard one to reach because you're now not talking about physical therapy anymore. You're talking about a physical therapy intervention that probably also needs a some sort of mental therapy and intervention. Number seven, and then this you will get this also, and this is it's sometimes a little easier to deal with this one I find, but um, sometimes your patients are going to have an attitude such that they don't want to listen to you, their physical therapist. They will think that they know everything. They know what is best for them. They are not going to, you know, really uh, entertain your suggestions for them very much. This I've run into this a good bit. I'll tell you one helpful tip or one helpful tip. Excuse me, I can't speak today. As to how I've dealt with that in the past is you break down the science there a little bit, and if you can get sometimes if you with that type of a patient, you can sometimes break through that, and by not big dogging them. So I don't want to make it sound like that, but you sort of are, where you go maybe a little bit talking in depth as to the reason that you're needing to, that patient is needing to do what you are wanting them to. You explain to them a little bit more than you maybe would with an average patient, maybe go a little bit more into the science of that. And then that can help you to get more, to steal from Jerry Seinfeld, get more hand in the relationship, so that then that person will listen to you. So I have done that a few times, and that does work. I find a lot of times they will kind of back down, and then all of a sudden, start showing you deference and start listening to you a little better, if you can kind of break through in that way. But it doesn't work 100% of the time, I've found, but that can be beneficial. Number 8. So this is the last thing that I thought of, as far as why patients may fail with you as a physical therapist, and um, all of the ones 1 through 7 have been unique in that this is all related to the patient themselves, or some aspect of that. Number 8, this relates to you. Um, Maybe you are not delivering the best physical therapy care for that patient and their dysfunction at that time. So the issue may be you. So that is something that, as a physical therapist, and you would hope as all healthcare professionals, that you are constantly reevaluating your own skills, reevaluating your situations with your patients. You are talking with other physical therapists to pick their brain. You are continuing to, read journals. You're continuing to learn yourself, because the issue, despite the majority of these being, and the vast majority being patient focused reasons for failure within physical therapy, you have a big part of this. Okay, all of these. The reason I even bring these up, and the reason I even have these as a topic, is to address them, because then once you kind of have an idea as to why is this person not going forward, then you as the physical therapist can say, okay, well, now how do I address this? How do I try to get someone who maybe is not compliant to become compliant with their home exercise program or whatever? So that way you can deliver the care that that person needs. So you as a physical therapist are going to have to work through those situations and those instances, and assess, why am I not making progress, and make changes. And that change might include with yourself. It's, it's rare. I haven't done it a whole bunch, but I would say in my 13, well, almost 13, 12, 13 years of practicing, um, a time or two, I would say I have referred a patient to another physical therapist, to and really more that's even more than a time or two. Sometimes, like I've had before, where maybe a patient had a previous physical therapist, and uh, really no matter, or I'll tell you exactly what it was. It was when I one of the clinics that I was managing. I had come in and I was working as a new manager, and the previous owner had done a significant amount of manual therapy within their practice, and he delivered one particular technique that I just didn't do. And it just was nothing, anything that I had been trained in. It was nothing that even in my DPT program that had even been introduced to. I really wasn't unaware of the treatment. and it's a contract relax kind of a thing. And in case you're wondering about that, it actually can be really really beneficial, and it's a good technique to learn and to have. But at the time, I really didn't know anything about that, and that form of treatment. There's a whole thing around that, and so I was doing more myofascial work, I would say at the time, and was treating this one particular patient with that, and it just ultimately it was not what the patient was looking for, and they were not making good progress. And so I was like, hey, look, I, I'm gonna find where this PT is, and I'm gonna refer you to them because you need their care. Okay, I can't give you what it is that you are needing because I don't do that particular treatment. Um, so within all of these, you need to, when you're treating a patient and when you're trying to make progress with them, is to assess to see, are they making progress or are they not? And if they're not, they fall under one of these 8 reasons that I've given you here. Then you want to look at that and address those particular issues to try to overcome those hurdles so that you can reach that patient to continue their progress and so that you can meet their goals and then discharge them to their full function or prior level of function. So anyway, I hope that this has been beneficial to you, and if you have any questions about this, please add comments below. Again, this is a new channel, so if this was beneficial to you, I'd really appreciate it if you would hit the thumbs up button, subscribe to us, and there are several more videos I've got that I'm going to be producing around this behind the doctorate idea. I really like this. It's having some pretty good success, I think, and we're going to be doing a lot more of this. But yeah, those are 8 of the reasons why a patient may fail with your physical therapy. All right. Well, y'all have a good one, and we'll catch you next time. Bye.